Hello, Dr. James Bogash, expert in health and longevity, and today we're going to talk about a pretty interesting study looking at breathing, and specifically breathing problems would be termed, the medical term is dyspnea, and people who are still having breathing problems after having COVID. And we've certainly given my opinion on long COVID. There's a huge psychological overlay, but the reality is there are people that have problems after COVID. Now, I think a huge chunk of those are probably driven more by stress and PTSD than they are reality, but one of the things that is very clear is that COVID can be pretty damaging to the lungs. And I think that society isn't very good at recovering from these. I think that we are more likely to sit on the couch and not push ourselves because we're worried about injuring ourselves rather than actually trying to exercise our lungs, just like we would anything else that was needed rehab after an injury. But for some reason the lungs don't seem to fall under this category, but they should. And we have a hyperbaric chamber in our office, and we've seen more than our share of people who've had lung problems after COVID that have done really well. So this particular study makes sense. And in it, researchers looked at 50 people who were hospitalized with COVID. Half of them were on a ventilator, half of them were not. So these are all people who had a pretty hard time. And 2/3 of them, even 15 months later, so a year and a half later, had moderate to severe dyspnea, or problems with breathing, on exertion. So going upstairs, forget exercise, these people are still having breathing problems years later, or a year and a half later. By this point, we can accept that they're probably not going to get better spontaneous. It's not like they're going to wake up tomorrow and it's going to be all hunky-dory. We're going to have to do things to recover from this. And I think, just like everything else in the body, we need to challenge ourselves. And so here's 4 different things that you can try if you happen to fall into this category. First one, as I've already mentioned, hyperbaric. If you have access to it, then hyperbaric can be a really great tool for respiratory problems. Makes a lot of sense. Not only are we increasing oxygen delivery to the rest of the body that may be suffering because the lungs aren't functioning well, but it's going to help heal the lungs themselves. Back to the study, one of the things that was very consistent in the people that still had dyspnea is that they had diaphragm weakness. That was a pretty consistent finding and correlated with the people that had breathing problems. So what can we do to strengthen our diaphragm? I already mentioned hyperbaric can help heal the lungs. Inspiratory training. This is not your breathe. So the flow, whatever the device is that you breathe through that are designed to keep the lungs from like after somebody has pneumonia or anything like that. This is inspiratory training, and training where you actually have a restricted device. I've used this before. A lot of people, athletes will use this, but you can use it for people who have problems with the diaphragm. It's a small device. You can get them. I'll put a link to one. They can be as little as $25, but you actually have to force yourself to breathe through this. This is a simple device that everybody can do at home, but it challenges the respiratory system. It challenges the diaphragm. It's designed to strengthen the diaphragm. Also, if you happen to have reflux, it may actually help with that as well, because the diaphragm plays a role in the lower esophageal sphincter. Side note. But inspiratory training, simple to do, takes a few minutes a day, and it can help strengthen the diaphragm, which may help with breathing problems. Anybody who listens to any of my videos knows I'm a huge fan of high-intensity interval training. For me, it may look differently than somebody who's still suffering from respiratory problems a year and a half after COVID. But the thing is, we need to challenge ourselves. Walking around the block isn't going to do it. It's okay to run out of breath for a short period of time. That's the goal of high-intensity interval training or short burst aerobic. we need to challenge ourselves. And when we do, the body has a tendency to come back and build things stronger. So going up a set of stairs, rather than avoiding it, maybe that's what we need to do to strengthen the respiratory system. And of course, on that same line, resistance training. So lifting weights, even if you run out of breath with them, that's part of the process of building back stronger. I think that a lot of people who I've seen who have had breathing problems just sit on the sidelines and hope that things will get better, but they probably will not. You need to force yourself to build stronger lungs, stronger diaphragm. And this article just supports the idea that a weakened diaphragm plays a role in post-COVID dyspnea. And there are tools that we can use to strengthen the diaphragm and hopefully turn this scenario around in each individual. As always, I'll post a link to this particular discussion, to this particular study in the description. Make sure you like this video, share it with somebody who you think needs the information, and subscribe to the channel.